Very welcome to this webinar about best practices for healthcare translation and localization. This is us at Care to Translate holding this webinar, and it's going to be me telling you a little bit about this. And with us, we also have Tove Karlsson from Doctrin, with whom we will chat with in a little while. So today's agenda is that we will have a short introduction on Care to Translate and what this is. And then I will talk a little bit about medical translation, why it is different than other translations, and some common challenges and pitfalls. After that, we will talk to Tove Karlsson, and then it will be some time for questions in the end. So during the presentations and chat, you can write your questions in the comments field, and we'll have time to answer them in the end, and maybe also do some verbal questions in the end. Okay, so Care to Translate was founded by healthcare professionals for healthcare professionals, just because we found a big need of communicating with patients that didn't speak the same language as the healthcare providers. Today there are, of course, existing means to communicate, and this is mainly interpreters, but they're not available all the time. When a patient comes to the hospital, there is a short while when you can speak with an interpreter. It is usually not there from the start if it's an emergency, and there is a lot of communication going on around that time when the interpreter is not there. And then you're left to other ways of communicating, for example, machine translation and other less secure ways of communicating. So this is why we created a tool, Care to Translate. It is a medical translation for healthcare professionals and patients that consists of verified phrases in 47 languages. And this can be used on mobile phones or tablets or desktops around the clock or offline if you wish. And you can also use the advantage of doing real-time translation inside the app as well if you need that. And it's created to be able to use in all sorts of communication. For example, when receiving the patient in the reception, asking important questions for patient safety, instructing the patients, making sure that you get the best compliance, inform and just calm the patient and tell what's going on. So that is Care to Translate, and please give us an email or contact us in some way if you're interested in that tool. But today we'll talk about translations of other medical texts, because when creating our own product, the Care to Translate app, we created an extensive translator network, and this is something that we found that we can use because the network that we have consists of native translations that have medical expertise. And since there are a lot of other both organizations and companies out there that have medical texts that need translation, we found that we can fill this gap. It could be digital platforms, it could be information leaflets from a healthcare provider, or it could be marketing material for a new medical device or medical product. And So the uniqueness of our network is that they're all native speakers and they do have some kind of medical education and working experience. And this makes the big difference because they're kind of fluent in medical lingo, which other translators are not. They're just regular people who don't know all the medical terms. And not taking this into account when you translate a text in a medical or healthcare setting, this will have consequences. So here I have listed some topics to speak about that are important in medical translations, and we will go through them all, starting from the top. So first of all, there are words and concepts in healthcare and medicine that are hard, a lot of hard words. Like the first ones there, regular people don't know the difference between encephalitis and encephalopathy, and neither do translators. So that's very important to know. Even if they can take help and search for information, it's basically not their field of knowledge. I mean, I have had experiences with inflammation and infection that has been intermixed. And I mean, it's a simple and huge difference between them, even if they sound similar and are slightly overlapping. But for example, my sister, who is both highly educated and a real bookworm, I still need to remind her of the difference between these two. And even if the reader will be a patient and the language should be simple and comprehensible, you need the base knowledge to keep it accurate. And also the healthcare organization. There are a lot of specific words and names and abbreviations within healthcare organization, and words that apply to different professions or organizational units of healthcare. And it is a very good experience if you've worked or are still working in healthcare to understand the material that should be translated. And also the different levels of urgency in healthcare, the different healthcare needs. That's also very important. A third thing with the medical translation is localization challenges. For those of you who don't know what localization is, it is when you adapt your text to a new market. So for we translate from Swedish to English, it could be for readers within Sweden who don't speak Swedish. But it could also be for the Britain market or the American market or the world market. And this is a challenge for the translator. And in healthcare, the organization looks very different in different countries. For example, some countries have private practitioners instead of healthcare centers. So you go to your own doctor that has his own practice. And that's not the way it looks in Sweden, for example. And that might be mirrored in the text, and you need to adapt that to another market. They don't have personal security numbers everywhere. It's instead maybe an insurance number that should be referred to. Different ways of signing in, like using BankID, is not used everywhere. You need to think of all of these things. Another example is the profession midwife. Midwives do very different things in different countries. Of course, they all do the baseline of delivering babies, but in Sweden, for example, they have a lot of responsibility during the maternal care before giving birth. In other countries, you go to see your doctor during your pregnancy. So it differs a lot between countries, and you need to know these things, which is not that common that regular translators do, because it's not their field of work, it's natural. In healthcare, you also handle sensitive topics. And this is important for translation because it's not always easy to translate these words because they're not used in everyday speech that much. You know, talking about your genitalia and peeing and pooping, you need to set the level of what words to use. This goes also with different genders and being inclusive with sexualities and stuff like that. You need to often take a stand in what degree your text should be inclusive. And since in languages the culture differences are mirrored, this is very important to have in the back of your mind when translating to different languages. Sexuality and genitalia and things like that can also have a stigma around them in different cultures. But that also goes for psychiatric diseases, for example. It's very different how open you can speak about things and how much you use euphemisms and other words when describing these things. It's an art form to keep it accurate but still not vulgar. I mean, some languages barely even have the word for female genitalia. It's in everyday language called something like the shameful thing down there. You can't write that if you want to be 100% sure that the reader perceives this as the vagina or what you're actually trying to say. And last but not least important, no matter what medical text you translate, if it's instructions, questions, informations, or interface details, it hopefully serves some purpose for patients or healthcare professionals. And since it does that, wrongful wordings or interpretations will have consequences, both leading to worse compliance. I mean, the patient or the healthcare provider might not be able to follow the instructions if the words don't make sense or if they are ambiguous and you can interpret them in several different ways. And this can, in the worst case, lead to malpractice, misdiagnosis, or even death if it's really serious. So this is serious business, and this is why you need to think twice when you translate texts that are used in medical settings or other settings in the health sphere. Okay, so that was a little bit in general about medical translations. And now we will talk to Tove Karlsson for a little while. She works at Doctrin, which is, let me get this right, it's a digital platform for communication in healthcare between patients and healthcare providers. And Tove, please tell us a little bit more about Doctrin and what it is to begin with.
Yes. So we do have a digital communication platform, mainly with chat and video and those sorts of tools, but also one of the main products in our product is our medical questionnaires. And that is what we are collaborating with you on, because when we go into new markets or grow in existing markets, it's very important for us to be both accurate, of course, but also to have a good match with the language in the questionnaires, both for patients and providers.
Yes. So what were you looking for when you were searching for a translation partner?
We thought that we were looking for solving the impossible problem. When we had our first communications around this, we didn't even know if you would provide this kind of service. But then the more we talked about it, we realized that you were actually solving the same problems that we had to solve. So that made you a good match. But the problems that like going into new markets with questionnaires is always to have a translation agency that's able to both understand the patient perspective and understand how they read, how they perceive things, and so forth, and also understanding the healthcare professional perspective. So if a patient responds to a question, they of course need to understand what that question means, and then what we tell the healthcare provider needs to be accurate, and so forth. And that is something incredibly complex, we realized over the years, because you need to have both good language skills, of course, but also very good in understanding of healthcare and the country and the culture and so forth.
Yeah, had you experienced some of these problems before working with us?
Yeah, we had. I mean, I laughed a bit when I saw your examples of different wordings where it could be a bit sensitive, or like what level of accuracy versus how vulgar it would be. So for example, I don't remember the exact phrasing, but we had some problems with like how to express the question, did you fart in the past 24 hours? And I think the first translation was suggested to be like, did you pass wind or something like that? And then when patients tried it out, they were like, what is this? And I guess, I mean, that's a problem that we have in healthcare in general as well. If we have too polite language, it might be difficult for normal people to understand.
Exactly. That's one problem. Yes, and so in the collaboration during the translation work, what is it something that you have learned from this experience that you can pass on?
Yeah, don't hesitate to rebuild, I would say. So
What, rebuild?
I mean, yeah, rebuild. Like from our perspective, since we start building in one language and then translate to other languages, you will get into problems where one word, for example, means something completely different, or maybe there's two translations with two different meanings in another language, like wound and ulcer in English is just one word in Swedish. And so then you need to like go back and make that transition possible. So I think doing that work and being humble about, well, languages will differ and there will be some inconsistencies, and the product needs to be able to handle that in a good way.
Yeah, and that makes me also think, because I know that you have had some challenges with keeping the text gender neutral. Can you tell us a little bit about that?
Yeah, that's also a fun cultural challenge, I would say. In Sweden, we do have a word for like naming both men and women in the same sentence, but some languages that doesn't exist. So that's difficult. But then on the other hand, even if there is a word, it's not commonly accepted. So that's also something you need to be aware of.
Yes,
but
exactly.
yeah, that's been, and I think like that is one of the biggest values that we have from this collaboration as well. And not only getting good translations, but also being able to have those discussions in between us and learn from each other.
Yeah, exactly. Because different languages both have different words for, like you said, addressing a person who is male or female or not known. But they also have different ways of conjugating different words, depending on if you talk to a woman or a man. So you need to have that in mind, and don't assume that all languages are like Swedish, because they're not. This is extra important if you work with a text that should be translated into multiple languages, because then you need to really take into account that it needs to be have the equal meaning in all languages. Okay, so what's the best way for someone to get started with localizing their product, you think?
Oh, that's the $1 million question. No, but I think like going on new markets is always to start small. I think is a good thing, and having what you think you need to be able to scale in place beforehand, and having that expertise that you need at hand, I would say. But not doing. I mean, I think many product companies will need to balance that. Like you want to build a perfect product and you want to meet the market needs, but then on the other hand, and especially with localization and languages, it's very good if you can get something out as soon as possible and really validate that with end users. So I'd say that's our main takeaway from doing this a few times.
Yeah, that's a good advice in many settings. Yeah, maybe sometimes it's convenient to take your whole thing, platform or whatever you have, and translate it all. But sometimes, and pretty often, it's good to start with a part of it to get it out there and just get started. And you will also learn a lot just with the first texts to see if there are if there are things that you need to rebuild or rethink going forward when translating the rest of it. So that's a very good advice. So for the future, what opportunities do you see in the future for Doctrin?
Oh, many, I'd say. I mean, healthcare in general has huge problems with finding an efficient way to communicate between healthcare professionals and patients. And I think we are like on that same journey together, both Care to Translate and Doctrin, to have that sort of product that solves those communication issues that we are, I think, in general, not that well aware of, because it's something that we just get used to. But then when you start working with that, you realize how much time you can save, how much effort you can save, how many errors you could prevent, and so forth. So I think there is huge benefits both in making healthcare more available and also bringing more quality or better quality to patients.
Yes, definitely. I mean, both your product and our core product addresses this, and I think even if you just do a little bit of translating some information for your patients, or just translating the fact that there is no other information available in your language, it just takes you pretty far in getting an alliance with the patient and making them understand that you're trying and you're doing your best. So even just translating some information or parts of your product or platform or information is valuable, definitely. What role does compliance play in medical translations at Doctrin?
Since we're talking medical questionnaires, it's extra important for us to be accurate. So that is something where like that requirement is extremely high on translation agencies that we work with, because what the patient said need to be displayed to the healthcare professional in an accurate way. So I think that's the biggest compliance aspect for us.
Yeah. Yeah, since you work both with the patient as a reader and a healthcare professional as a reader of more or less the same content. In your case, it needs to sometimes be translated from layman lingo to medical lingo, so to speak.
Yeah.
So that's very important. Yes. So what advice would you give others when it comes to collaborating with translation companies? it's fine. You can tell me if there's been something you would like to improve or something to think about.
No, but I would say have your requirements in place beforehand. And that's what we did when we started communicating with you, because we had learned a bit along the way, and we knew more about the needs that we would have, both at that moment, but also for the future. So we made an extensive list of requirements, quality related and so forth. And then we met with a few different agencies and compared and had like tests of everyone to see how the performance was actually. And that was super helpful, because when you are in dialogue and everything sounds nice, right? So it's when you see it in practice and see how it works out, that's when you know if it's gonna work or not.
Yes, so we're soon about to round up this webinar, but I think those are very good advice. And even if you don't know quite exactly what your needs are, it's also a good way of just starting to take a contact and describe your products and what the needs you think you have. And with our experience, we can together like find out what will be the challenges with your project, and what is the right way to go. So don't hesitate to also take help with these questions. Okay. So I say again that please contact us with any questions, either to me or to our info mail, both regarding the app or if you have translation projects that you need to take a look at. And we wish you all a very nice Tuesday.